For me, part of that history of, and I think the HIV pandemic was really that impetus of Indigenous people involved in health research in Canada back to the mid 80s, the late 80s. And we got access that probably would not have happened in a timely manner unless it was the seriousness of HIV. In that people were on committees, we went to national conferences, we liaised with governmental, provincial, territorial, or federal staff at the high levels of health, because in many ways it was urgent, right? There was a global pandemic. It was urgent, and that really escalated our introduction into community-based research and these different systems that were invested in health research and social research and International AIDS Conference as well, which we'll be going to. But for myself, looking back at that, for me, the HIV pandemic, I was there in 1979 in Vancouver at the epicenter. And now, 40 years later, I reflect back on that. And I do have research questions because it was predominantly for the Indigenous community, two-spirit gay men, bisexual men who were at risk of becoming infected. And we don't know, we don't know how many Indigenous gay men, passed away from HIV or AIDS in those 20 following years. We don't know which ones didn't, what the resilience factors were for those. So that's a 40-year span of one pandemic, and now it's intersecting with COVID. So it's these layers, and to me, it's like, as a two-spirit person, I did, beginning in '83, go for an HIV test, and my doctor's still around. He's retired, but again, it was that relationship with the sciences, which is, we have the HIV test by '83, '84, and then, I have the 4 vaccines. And so for me as an Indigenous person, I do practice tradition and culture, but I also monitor and access, the Western medical science, to survive. So, I was HIV testing in the, 80s and 90s, and now with COVID, I have 4 vaccines. So it's that interrelationship of, as an urban Indigenous people, practicing both, traditional lifestyle, traditional knowledge, traditional practice, but also monitoring and accessing what Western research provides to gather through these pandemics or epidemics.